Welcome back. We know COVID-19 has impacted the healthcare system in ways that we have not seen before. Joining me now in this sponsored segment to talk more about this today is Mark Robinson, the CEO of St. Mark's Hospital and part of Mountainstar Healthcare. Mark, thanks for joining us today at 4.
Hey, thank you.
Let's begin with the economic effects of COVID-19 and how this is all impacting and affecting your staff.
No, absolutely. I mean, we know that people are really doing what they're told to do right now, and they're staying home trying to ride out this curve, and that means people are not utilizing the hospital as much as they normally would under normal conditions. So what this means for my staff is the fact that we're not as busy at the hospital. Therefore, we look for opportunities for our staff to be redeployed at other places so they can continue to work at their full capacity.
And locally, HCA hospitals include the Mountainstar network. So what are some of the programs put in place to support these hospitals?
Sure, in support of that redeployment, if there's ever a point where we cannot redeploy in our Mountainstar network of facilities an employee to continue to work, they can take advantage of what we're calling pandemic pay, and they will continue, whether they're working or not, will continue to get 70% of their base wage while other benefits stay intact as they are today for them. So a very nice offering for them so that we meet our goal, really, and our goal is to not lay off any full-time or part-time employees.
That's great news there. And beyond that financial support, I understand you guys have even more benefits in place to help protect your teams and their families. Can you talk about some of that?
Yes, ma'am, sure. So one other benefit is those frontline caregivers, if they even experience signs and symptoms of the COVID-19 virus, they will go on what is called quarantine pay. So they will go home for a 14-day stretch and they will receive 100% of their pay while they weather the signs and symptoms of the coronavirus. Also, we have in-house scrub laundering, so most of our caregivers, of course, come to work in scrubs. We don't want them to take home anything they may be exposed to while at the hospital, so they can come, change into their scrubs, change out of their scrubs. We will launder them for free. We also have local agreements with major hotel chains by which if people choose not to want to go home and they're a frontline caregiver of patients, then at no cost to them, they could stay in a hotel that we've partnered with. We also worry about our employees' mental health. There is a line 24/7, 365 that they can pick up and call and talk to a mental health provider. And then one thing we've done at St. Mark's that I think is very important that I am sure the other Mountainstar hospitals will follow is we've opened up a grocery store for our staff. We have ordered a little more things that we won't lose cost on, and we pass through at cost to our employees groceries that otherwise they would have to stop at a grocery store and get. Now they don't have to.
I know your teams are working hard out there. Quickly in these last 30 seconds, what do you want the community to know about your teams?
You know, I want them to know that above all else, we're committed to the care and improvement of human life. And that human life is not just the patients we serve, it's also our employees. And they are of the utmost importance to us every day. And we are so proud of the heroes that we're able to be blessed to work with on a daily basis. They're doing a great job for the greater Salt Lake community and for anybody that comes to our hospitals.
Thank you so much for joining us today, Mark. And for more information, our viewers can go to stmarkshospital.com. We'll also have that information on our website, abc4.com. Again, thank you, Mark.
Thank you.